Hello students, this is the last chapter which I am going to cover, that is orbit. Okay, so before studying the orbit and orbit related diseases, let's know the proper anatomy of the orbit. So you might have already studied this in your first year, but it is need to know in details about the orbit, the bones and its contents. Okay, so it is a quadrangular in shape. Okay, and it is almost, when you see from front to posterior part, it is pyramidal in shape. Two pyramidal shape structures or the bony structures which are separated by the nasal bridge. Okay, then when you look into the picture, it is superiorly related to the cranial fossa. The medially, it is related to the nasal cavity and the ethmoidal A sinuses will be there. And inferiorly, it is related to the maxillary sinus. And the lateral is related to the middle cranial and the temporal fossa. So it is okay. There are 7 bones in orbit. They are the frontal bone, okay, then the zygomatic bone. This is okay. This entire thing is. Then the lacrimal bones. These are the one. Then the maxillary bone, which is very bigger one. Then the sphenoid bone, which are the internally you can make out. Then the palatine bone. Okay. Then the walls of the orbit. We have the 4 walls. One is medial wall, then the lateral wall, and the floor, and the roof. Coming to the medial wall. The medial wall is made up of certain bones. That is the frontal process of the maxilla, then the lacrimal bone, okay, then the orbital plate of the ethmoid, where it is ethmoid bone, that is the orange one. Okay, then the body of the sphenoid bone, which is having the optical canal. So these are the structures which makes the medial wall. So you can make out this is almost adjacent to your nose and the nasal bridge. So what are the clinical applications of the orbital wall? So it is very thinnest wall of the orbit. Okay. So whatever the contents or the any infection from the nose is easily spread and it is easily eroded because of this chronic inflammation. So the spread of the infection from the nose is very frequent from this nose. And whenever there is a blood fractures, blood injury, this is the first wall to get injured during such circumstances. Okay, and even the hemorrhages occurs through the injury to your ethmoid. The lateral wall. The lateral wall is the toughest wall amongst all the walls. It is the thickest, which is made up of the zygomatic as well as your greater wing of the sphenoid. So what are the clinical applications? The lateral half of your globe is covered. It is a protective wall as such to say, because it is the toughest. If any injury, if anything occurs from the temporal side of the part of your orbit, it is a very protective bone, and it is as it is a very tough bone, the injury to your globe is it is avoided. Okay, and as it covers the half of your the globe, so any the tumors are there are easily palpable and easily felt through the lateral bone. Okay, then roof of the orbit. The roof of the orbit, it is made up of the orbital plate of the frontal bone, then the lesser wing of the sphenoid. So what are the clinical importance of this? So whenever there is an injury through your upper lid towards your roof, so what happens? This get damaged easily, and this affects to your frontal lobe of the brain easily, and there is a possibility of CSF leakage into the orbit, where you have to repair it as soon as possible because injury to your orbit. Then the floor of the orbit, it is also the triangular in shape, and it is made up of zygomatic bone, the palatine bone, and the maxillary. Okay. And it is inferiorly, it is related to the maxillary sinuses. It's just above the maxillary sinus. So any infection from this maxillary sinuses are easily spreaded, and so any blood, the fracture of this floor, the eye is displaced down into this the sinus, and there can be the hemorrhage and into this maxillary sinus, and the muscle get entrapped into this bones. There can be a diplopia. So any tumor from this maxillary sinus, it can spread from downward to the upward into the orbital. Okay, what is the base of this? Base is the whatever the margin of this the orbit is. So we call it as into the superior orbital margin, and the inferior orbital margin, the lateral, and the medial orbital margin. So apex of the orbit, as I told you, it is in a pyramidal shape. Yes. So all these walls they fuse together posteriorly, forming the apex of the orbit. So there we can find out optical canal and superior orbital. So of the optical canal, through this it is a circular space. Through this optical nerve and ophthalmic and artery passes. And you have a superior orbital fissure. So it is divided into three parts by zonulus of zinc. That is the ring, the orbital ring, what we call it as. So upper lateral part, middle part, there are different contents which passes through that. You must be already aware of this. In the upper part, the lacrimal and frontal nerve, trochlear nerve, and veins, that is superior ophthalmic vein, and the recurrent branch ophthalmic artery passes. In the middle, we have superior and inferior divisions of the oculomotor nerve, mesociliary branch of ophthalmic division of the trigeminal nerve, and abducens nerve. And in the lower part, only the vein passes, that is the inferior ophthalmic vein. And the structures which are passing through this is more important, because any inflammation at the apex, so all these structures are involved, and it leads to the movement of the eye is very much okay. So whenever there is an enlargement of this superior orbital fissure, so you can think of there can be a aneurysm, meningioma, choroidoma, pituitary adenoma, and tumors of the orbital apex, and it causes very painful, the condition call it as a Tolosa-Hunt syndrome. That is a painful ophthalmoplegia. Then coming to the surrounding, that is a periorbita. Periorbita, it is the periosteum. Okay, so the space or the structure or the layer which covers the bony part, that we call it as a periorbita. So it is firmly attached at the orbital margins, and wherever there is a suture lines between the two bones, and at the features and foramina and the lacrimal fossa. So in the orbital fascia, it is a complex interbone thin connective tissue membrane joining the various orbital structures. Again, it has a different parts, that is we call it as a fascia bulbi, muscular sheaths, intermuscular septa, and the ligament of long. So we have different muscles, you must be already knowing. We have 4 recti and 2 oblique muscles. Okay, the recti are superior, inferior, medial, lateral rectus. Obliques are superior and inferior oblique muscles. So apart from that, you have a levator palpebrae superioris muscles which transmits to your lid, and there are involuntary muscles. Those are superior tarsal and molar muscles. These are part of levator palpebrae muscle itself, and inferior tarsal. The eye is divided into, orbit is divided into 4 surgical spaces. One is subperiosteal space, that is the space between your bone and the periorbital fascia. Then periorbital space, that is the space in between your globe, that is a muscle cone, and your periorbita. And the central is the space, that is intraconal space, that is in between the that is just behind your globe and in between the muscles. Subtenal space, the space just below your tenons. Okay, so why these spaces are important? Because whenever you are exploring the tumor or the collection, or you want to do for the surgery, and you can assess from which area the pathology is coming from. So it's very important to assess from which species involved and helps in the treatment. Okay, as I told you, subperiosteal space is a space between your bone and the periorbita. Okay, so sometimes whenever there is the bony tumors which arises from that, so that leads to the separation of and enlargement of this space. So the tumors arising from usually you can see in these spaces are dermoid cyst, epidermoid cyst, mucosal, subperiosteal abscesses, and osteomatous tumors. So whenever there is tumor, the space involved you can make out is superiotemporal area. Okay. Then peripheral space. As I told you, this is a space behind that is extraconal, that is outside your muscle cone, but beneath this subperiosteal space. Okay. So so whenever we are giving the block, so it is the peripheral orbital space before the surgery, and the tumors in this space are usually approached by the anterior orbitomy, sometimes by the lateral orbital. So the tumors which you can see in this area, malignant lymphoma, capillary hemangiomas, then pseudotumors, and intrinsic neoplasm. So whenever there is a tumor in this space, the eye is usually pushed to the opposite side. In eccentric proptosis will be there, as well as there is displacement to the opposite side of the tumor. The central orbital space, it is the space just behind your globe and in between this muscle cone. So there are a lot of structures which are present in this. There are many vessels will be there, optic nerve, central retinal arteries are there. Okay, so whenever there is a tumor in this space, the eye is in axillary it is pushed forward. So there is a very eminent proptosis you can make out, very obvious proptosis, axial proptosis you can make out whenever the tumors are there in the central orbital space. So the common tumors you can make out are the cavernous hemangioma, solitary neurofibroma, nodular orbital meningioma, optic nerve. The most common thing is the optic nerve glioma. Then subtenal space, the space just below your tenons. So whenever there is any collection is there, blood is there, pus is there. So there are some specific needles are there. So through that you are entering and you are cleaning the collection in the subtenal space, as well as you can use this for giving the local block during any surgeries and also for the drug deposit also. Some sort of steroids also some can deposit into this abdominal space for the longer release or the period of the release of the steroids. Sometimes you can use the anti-glaucoma medications also. So the contents of the orbit. The contents of the orbit, yes, it's all the contents from the eyeball to muscles, your vessels, nerves, ganglions, gland, fat, everything's dissipated into this, the orbit. So, students, this is about the orbit, anatomy of the orbit. So, in next class, we'll start studying about what are the different the pathological the conditions which arise in the orbit. Please go through the detail of this orbit. Thank you very much.